Welcome back to Insects for Fun. I'm your host, Mitchell Logan, and today we are talking about ticks. We're going to do a full comparison episode on wood ticks and deer ticks, what they are, how to tell them apart, what diseases they carry, how their life cycles work, and most importantly, what you should actually do when you find one on you. This episode is practical and it could genuinely help you, so please share it with anyone you know who spends time outdoors. And with that, let's get started. Wood tick and deer tick are common names, and like most common names in entomology, or arachnology in this case, they're used loosely and refer to more than one species. Deer tick typically refers to the black-legged tick, Ixodes scapularis, found in the eastern half of North America. In the western US, there's a close relative called the western black-legged tick, Ixodes pacificus, which does the same job on the Pacific coast. The name deer tick is actually considered somewhat outdated now, and the preferred name is black-legged tick, but deer tick is so deeply embedded in everyday language that we're probably stuck with it. So we're going to use both. Wood tick usually refers to the American dog tick, Dermacentor variabilis, found predominantly east of the Rockies. Now there's also the Rocky Mountain wood tick, Dermacentor andersoni, which you guessed is found in the Rocky Mountain states. For this episode, when I say wood tick, I mean Dermacentor variabilis, the one you'll find in Vermont and across the Northeast. Both species belong to the family Ixodidae, the hard ticks, named for the hard plate on their backs called the scutum. You might be thinking that dog ticks are only found on dogs, but both will happily bite both animals. Though it is true that each species has a preferred definitive host as adults. Deer for Ixodes, and dogs and other mid-sized mammals for Dermacentor. But neither is particularly picky about whether its next meal is on 4 legs or 2. Okay, so how do we tell them apart? This is the most important section of this episode, so I'm going to be really specific. Being able to identify which tick you found matters because these two species carry different diseases and have different risk profiles. The first and most reliable visual cue is size. Deer ticks are small, like really small. An unfed adult female is about 3 millimeters or an eighth of an inch, roughly the size of a sesame seed. Nymphs are about 1 to 2 millimeters. That's the size of a poppy seed. Now, if you barely noticed the thing you just pulled off your arm, it's probably a deer tick. Wood ticks are noticeably larger. Unfed adults reach about 5 millimeters or a fifth of an inch, which still isn't huge, but it is meaningfully bigger than a deer tick. The second cue is color and pattern. Wood ticks have distinctive white or silvery markings on the scutum, that hard dorsal plate. On females, the white marking is on the scutum only. On males, it covers most of the back. This ornate pattern makes wood ticks much easier to spot. Deer ticks, by contrast, have a plain, dark scutum, no ornamentation, and the rest of the unfed female's body is a distinctive orange-red that contrasts with the dark plate. The legs are dark too, which is where the black-legged part of the name comes from. I would Google both and do a side-by-side comparison like right now, because I'm making no promises on when the photo dump for IG will happen. Anyway, once you see the difference, you won't forget it. Third cue, habitat. Wood ticks prefer open grassy areas, field edges, and brushy paths with little or no tree cover. Deer ticks prefer wooded deciduous forests, shrubby edges, and leaf litter. In Vermont, if you're coming in from a walk through open fields or along a mowed trail edge, more likely a wood tick. Coming in from wooded hiking trails, especially through leaf litter, you're gonna most likely end up with a deer tick. Of course, both can show up anywhere, but habitat is a useful prior. Fourth cue, season. You see, wood tick adults peak in activity during May and June. Deer tick nymphs, the most dangerous stage, also peak in May and June. But deer tick adults are most active in October and November, and can even be active on mild days throughout the winter. If you find a tick on you in October or November, it's almost certainly a deer tick. So let's dive into that life cycle. Both species go through the same 4 life stages: egg, larva, nymph, adult. And both take roughly 2 years to complete a full life cycle. But the way they move through those stages differs in some important ways. So let's walk through the deer tick life cycle since it's the one with the most public health relevance. Eggs are laid in spring in the leaf litter. A single female can lay up to 4,000 eggs before dying. Larvae hatch in late summer as 6-legged tiny things about 1 millimeter long, and their first blood meal is usually from a small rodent. Most importantly, the white-footed mouse. This is critical because white-footed mice are a reservoir host for the bacterium that causes Lyme disease. Mice carry the bacterium without getting sick, and when a larval tick feeds on an infected mouse, that tick then becomes infected. The larva drops off, molts into a nymph, and overwinters in the leaf litter. In spring of the second year, the nymph becomes active. Okay, that's like a big thing to take note of. It's the following spring when the nymphs are going to become active. And this is the most dangerous stage for humans because nymphs are, again, poppy seed sized, and they feed on a wide range of hosts, including humans, and they're active in May and June when people are spending lots of time outdoors. Up to 25% of nymphs may carry the bacteria which causes Lyme disease. That's in the Northeast. In the fall of the second year, the nymph molts into an adult, and adult deer ticks peak in October and November. Wood ticks follow a similar 3-host pattern, but tend to feed on larger animals at all stages. We're talking rabbits, raccoons, dogs, and deer rather than mice, which means they're less directly tied to the white-footed mouse reservoir cycle that drives Lyme disease. Which is gonna lead us into the health risks. Honestly though, the vast majority of tick encounters don't result in disease. But knowing what each species transmits is important and genuinely useful information. Deer ticks / black-legged ticks are the primary vectors for Lyme disease in the eastern US. In the Northeast, up to 50% of adult deer ticks in some areas carry the bacteria for Lyme. If you do happen to get bitten and infected, then the first sign is usually a bullseye rash. We're talking like 60 to 80% of cases, followed by flu-like symptoms: fever, fatigue, headache, joint pain, and stiff neck. If caught early, it's treated effectively with antibiotics. But if left untreated, it can spread to the joints, heart, and even the nervous system. Deer ticks also transmit anaplasmosis, which causes flu-like symptoms, babesiosis, a malaria-like illness targeting red blood cells, Powassan virus, which is a rare but serious one due to brain inflammation, and hard tick relapsing fever. They're genuinely the most medically significant tick in the Northeast. Wood ticks and American dog ticks are the primary vectors for the disease called Rocky Mountain Spotted Fever. Despite its name, Rocky Mountain Spotted Fever is actually more common in the Southeast and Mid-Atlantic than in the Rockies, and it's characterized by fever, headache, and a spotted rash, and it does require prompt treatment. The wood tick is not a vector for Lyme though, even though it may be exposed to the bacteria. It just can't transmit it effectively. So this matters because if you pull off a large pattern tick and you're worried about Lyme specifically, the odds are more in your favor that you don't get it. So you get bit by a tick, right? What's the prognosis? Well, there is a 24 to 36 hour rule, and this is why prompt removal matters. One of the most important practical facts in this episode for Lyme disease is that the tick generally needs to be attached for at least 24 hours before it can transmit the bacteria. The CDC states that in most cases, it takes over 24 hours of attachment, and the risk increases significantly after 36 to 48 hours. This is because the bacteria lives in the tick's gut and needs time to migrate to the salivary glands before it can be transmitted. Now, and this is important, this doesn't mean you should be relaxed about a tick that's been attached for, let's say, 20 hours. It means that finding and removing a tick promptly is one of the most effective things you can do to prevent Lyme disease. A tick you find and remove quickly, even if it's a deer tick, is unlikely to have transmitted anything. This is why doing a thorough tick check after every outdoor excursion is so valuable. The practical removal advice is to use fine-tipped tweezers and grab as close to the skin as possible. You're then going to want to pull upward with steady, even pressure. Don't twist, don't burn, don't cover with petroleum jelly, because those methods can cause the tick to release saliva into the wound, and that actually increases the transmission risk. Clean the bite area with rubbing alcohol or soap and water after removal. Also, note the date and what the tick looked like if you develop a rash, fever, or flu-like symptoms in the days or week following. But honestly, you should just keep the tick and have the tick tested, because you can do that, and then you can rest assured, or not, depending on the results, much faster than waiting for symptoms to appear. So as most of you probably know at this point, I did move back to the US and I now live in Vermont again. And apparently the tick situation is getting worse, which means it's probably getting worse in Massachusetts as well as other New England states. Vermont actually consistently ranks among the highest states in the country for Lyme disease, per capita. The Vermont Department of Health reports that black-legged tick activity peaks in May and June for nymphs, and again in October and November for adults. But importantly, deer ticks can be active anytime temperatures are above freezing. Winter hiking in Vermont and other New England states is not tick-free. Mild winters in recent years have actually extended tick activity pretty significantly. The single most effective habitat for deer ticks, at least in Vermont, is the forest field edge, the transitional zone between woods and open grass where leaf litter accumulates and white-footed mice are abundant. If you're hiking, sitting, or working along these edges in spring and fall, that is peak exposure territory. Now, if you're still with me, congratulations, because we made it to the prevention that actually works. Let me run through what the evidence actually supports for tick prevention, because there's a lot of folklore out there that doesn't really hold up. DEET works. Applied to skin, it's effective against ticks. Look for concentrations of 20% or higher for meaningful protection, and reapply as directed. Permethrin on clothing is also very effective. It's arguably more so than DEET on skin for ticks specifically. You can actually buy pre-treated clothing or treat your own, and permethrin binds to the fabric fibers and kills ticks on contact, which is crazy. It also survives multiple washes, which I didn't know until now. And this is one of the most underused prevention tools out there. So a couple other things that you can do though are tucking your pants into socks. It looks ridiculous, yes, but ticks climb from the ground up, so keeping them on the outside of your clothes where you can spot them matters a lot. Light-colored clothing also helps, and I personally know this because I've been able to find a few very easy with my super bright colored shirts while I'm doing my thing with my landscaping company. Now, the other part too is that you should shower within 2 hours of coming inside. Studies show this significantly reduces tick attachment and transmission. And of course, it can also help you find any ticks you missed during your tick check. So a tick check basically includes like a thorough physical check, including scalp, behind ears, armpits, back of knees, and groin, because these are the warm hidden spots that these ticks seek out. Also, you could do yard management. Keeping grass mowed, clearing leaf litter from yard edges, and creating a wood chip or gravel barrier between lawn and wooded areas reduces deer tick habitat significantly. Deer ticks hate dry, sunny, open grass. They desiccate quickly without moisture. So that's a really good thing to know. Okay, so Lyme disease landscape. I want to spend this final moment to talk about Lyme disease specifically because there's a lot of misinformation around it and it's worth having accurate expectations. Lyme disease is the most common vector-borne disease in the United States with over 476,000 cases diagnosed per year, according to CDC estimates. And that's likely an undercount. The Northeast and Upper Midwest account for the vast majority of these. Early-stage Lyme disease, caught within 2 weeks of the bite, is treated effectively with a standard course of oral antibiotics, and most people recover fully. The bullseye rash is the most famous symptom, but again, it really doesn't appear in 20 to 40% of cases, so the absence of a rash doesn't mean anything. Late-stage Lyme disease, if untreated or undertreated, can cause persistent joint pain, neurological symptoms, and cardiac issues. There is ongoing scientific debate about what's sometimes called, quote, post-treatment Lyme disease syndrome, unquote. Now, this is a condition where some patients continue experiencing symptoms after standard antibiotic treatment. The mechanisms behind this are still being researched. And what's not debated is that early detection and treatment does dramatically improve outcomes. This is worth repeating. If you find a deer tick and develop any symptoms in the following month, see a doctor. All right. And with that, let's wrap up the episode. I know it was a bit heavier on practical health information than usual, but honestly, if you live anywhere in the Northeast, this stuff is worth knowing. I mean, hey, this is even useful for like Northwest. I mean, anywhere where Lyme is a potential issue, this is good to know. So the best tools we have are awareness and prompt action. And with that, go do a tick check. Thanks for listening to this episode of Insects for Fun. As always, if you enjoy the show, please make sure to give it 5 stars on whatever platform you listen. And if you want ad-free episodes, bonus episodes, and vlogs, you can go find them at the Patreon. So that's patreon.com/insectsforfun. And you can also send me ideas for future episodes to insectsfordummies@gmail.com. Or you can send me a message on Instagram. All right. Thanks again for listening. And go do a tick check.